Hello everyone, I'm Mauro Cancian from the University Hospital of Padova, Italy, and I'm very proud to present on behalf of my co-authors the results of a survey on the burden of treatment in the Italian patients with hereditary angioedema, a rare disease with a prevalence of around 1 in 50,000 persons. Hereditary angioedema is a very painful, disabling, harmful disease due to the possible involvement of the upper airways. Therefore, current guidelines recommend considering treatment of all acute HAE attacks, treating as early as possible to reduce the severity and the duration of symptoms, and ensuring that patients have a sufficient supply of medication to treat at least 2 acute episodes, since individual attacks may show rebound or recurrent attacks may occur in close succession. However, as in real life, patients' adherence to guidelines may not be optimal for several reasons, the Italian Network for Hereditary and Acquired Angioedema, Ithaca, planned a survey in patients with hereditary angioedema with treated at least one acute attack in the past 3 months. A total of 101 patients were recruited, representing approximately 10% of the Ithaca hereditary angioedema cohort, including 14 adolescents. The mean time since the last attack was 19 days, thus minimizing the potential recall bias. The mean time to on-demand treatment after attack onset was around 3 hours, with only 10% of patients using specific medication within 1 hour, and an interval of at least 2 hours in 70% of cases. This delay was even higher among the adolescents, as you can see on the right side of this slide. As expected, the longer the interval between attack onset and treatment, the higher the severity of symptoms at the time of drug administration. No attacks were mild after just 1 hour. 50% were severe or very severe at 2 hours, and over 70% at 5 hours. Treatment was not administered early for several reasons, both with intravenous and subcutaneous medications. However, the top 5 ranked barriers to not treating attacks sooner were in order as shown from top to bottom: the uncertainty about the true nature of symptoms, especially for abdominal attack, which may be confusing for patients at onset, the mistaken and the wrong impression that the attack would remain of mild intensity, the desire to conserve medication in case of more severe events occurring in close succession, waiting for symptoms to worsen, and finally, in 5th place in the ranking, the need to continue ongoing activity. So, based on result and clinical experience, we can conclude that when we consider early treatment of attacks, adherence to guideline is still limited, that multiple barriers hinder timely treatment, that there is a treatment burden in addition to the general disease burden, and that recently approved oral therapies for acute management, as well as those currently under pivotal investigations, could facilitate the use of on-demand medication and improve patients' adherence to guidelines. Thank you for your attention.